about our exciting research with the Utah Hero Project. I'm sure that everyone has heard now about the new guidelines that the CDC released this morning about the change in social distancing guidelines in schools from 3 feet of social distancing from 6 feet to 3 feet. And we're excited to detail how this research that we did here locally was part of what guided this new announcement from the CDC. So today we have 2 of our experts who were part of this research that are going to speak to us today to kind of talk about how that happened, how the study got up and running, and what our involvement was about. We don't have anyone that was available to be with us from the CDC today, but they did send us a statement that I wanted to read and share with you. So the statement that they sent us was: a study from Utah published in today's MMWR presented findings supportive of CDC's revised guidance allowing for 3 feet of distance between children in school settings. The Utah study, one of many across the nation, affirmed CDC's recommendations that schools should return to in-person learning, and that doing so can be accomplished safely for the protection of students, teachers, and communities. So with that, I'm going to introduce our 2 experts that we have today. First, you're going to hear from Dr. Adam Hirsch. He's an MD and PhD professor, Division of Pediatric Infectious Diseases, and he was the lead study investigator with the Utah Hero Project. And then we will hear from Dr. Andy Pavia, who is our division chief of Pediatric Infectious Diseases. So we are going to start with Dr. Hirsch, who's going to tell us a little bit about the study and how it came to be, and then we will turn it over to Dr. Pavia. When the 2 of them are done with their statements, we will take questions from media, so if you'll please use the chat feature, that's how we'll get that started. Thank you so much.
Hi, and thanks everyone for attending today. My name is Adam Hirsch, and we're pleased to share with you the results from our recent work. We investigated how often SARS-CoV-2, the virus that causes COVID-19, spreads in local elementary schools. This study took place at a time when the community infection rate was very high and took place in schools where students were spaced 3 feet apart on average. These schools used several prevention strategies to limit spread, most importantly, strict requirements for mask use. Overall, we found very low rates of in-school transmission. The way the study worked was we started by identifying cases among students, teachers, or staff who had attended school during their contagious period. We then tested as many of their in-school contacts as possible 5 to 7 days later to track spread. This took place in 20 elementary schools in the Granite School District, along with 1 independent school in Salt Lake City. We included 51 initial cases, and they had over 1,000 in-school contacts altogether. We were able to test 70% of these contacts, or 735 individuals. For any contacts who tested positive, in order to distinguish between infection that was likely acquired in school versus acquired out of school, we performed detailed histories, we tested their household members, and also performed genetic sequencing to compare the initial case to any positives among their contacts. Overall, we found 5 secondary cases that were likely due to school exposure for a secondary attack rate of 0.7%, or 7 per 1,000 contacts. In 4 out of 5 of these cases, there were obvious breakdowns in prevention strategies, including poor mask use, which helped us understand why transmission could have occurred in these instances. We also found that in most of the cases where the infection was presumed to have originated from school, there was secondary transmission back into their homes, which reinforces the importance of limiting in-school spread. Additionally, we tested more than 100 students who would have been quarantined under our quarantine policies from the fall as close contacts, but were now permitted to attend school based on their mask use. None of these contacts tested positive, which provided support for our current quarantine policies for schools. In summary, secondary transmission of SARS-CoV-2 was very infrequent in Utah elementary schools that were using multiple prevention strategies, most notably universal masking, even during a period of very high community incidence and with students usually spaced 3 feet apart. This validates that these prevention efforts are working and that in-person learning can be done safely in elementary schools under these conditions. We hope that this provides reassurance for our school communities throughout the state and for other communities throughout the country, many of which are struggling with decisions around school opening and school operations. Thank you, and now I'll turn it over to my colleague, Dr. Andy Pavia.
Thank you, Adam. This is a really important study, and it wouldn't have been possible without the terrific collaboration that involved many people, the team from CDC, the people in the Granite School District, people from Salt Lake County Department of Health, the Utah Department of Health, and the Governor's Office of Management and Budget that funded the HERO project, and the investigators here at the university in the HERO project, at the School of Medicine, and at the David Eccles School of Business. Every study in an area like this adds a piece of evidence, but this is one of the stronger pieces of evidence yet, that taken together with all that we've seen in studies throughout the country and throughout the world, that certainly in elementary schools, that in-person schooling can be safe when there's a multi-layered prevention strategy that is really accepted and really enforced and put into place. Important findings that Adam mentioned, that was when mask use was used consistently and all the other prevention measures were in place, that even in classrooms where the average distance was only 3 feet, there was very little transmission, 7 cases per 1,000. The other flip side of this that's very important is the transmission from students who became infected in school to members of their household was much more common than it was from masked student to masked student. Some people doubt why it's important to prevent infection in school. Of course, it's important to prevent illness in kids. We want to protect them. But children in school do spread disease to their family, and beyond that, to other vulnerable members of the population. So this provides tremendous reinforcement for that. So taken together, we're at a point where we really understand that in-person schooling can be done safely with multi-layered, strictly enforced prevention measures. It really enforces and reinforces the governor's recommendation that we continue masking throughout all schools in Utah, at least through the end of this school year, and provides us reassurance that we do know how to make schools safe. One final thing I'll mention is that in these schools, there was very little extracurricular activity in which kids could mix. Team sports were suspended and activities outside of the classroom were largely not happening. So it tells us a lot about the safety of the classroom, but not necessarily about all the activities that children are involved in throughout the school day. This has particular relevance to children in older age groups that weren't studied in this study. It included children up to 6th grade, and it tells us relatively little about those in middle school and high school. And I think I'll stop there because I think the questions are going to be the most interesting part.
All right, thank you, Dr. Pavia and Dr. Hirsch. We're going to start with questions now. So put this in the chat feature. Paul Nelson has put something, which is where I was going to start the discussion anyway. And Dr. Pavia, you just touched on this. So this study is really looking at elementary school aged kids, but I know everyone who has kids and as parents, they're excited to get everybody back in school. How might we take this data and be able to glean something from it for older kids? And what Paul is specifically saying is there a way that we can use this to look at when they might be able to get back to activities like school concerts and dances, for example? Is there a way that we can use this data to maybe apply some of that to what we're looking at for secondary schools? Dr. Pavia, do you want to take that? And maybe then Dr. Hirsch, you can jump in as well.
I mean, it's a good question, but it's a difficult one to answer. You know, this study looked specifically at the risk of transmission in the classroom. And we think that and based on, our experience in other studies, we think that it can be extrapolated to the risk in the classroom in the older grades where people are sitting still, wearing their masks, steps have been taken to improve ventilation and the like. Extrapolating it to activities that occur beyond the classroom is difficult because now you may have things like exercise with higher breathing rates, you may have people taking their mask off. And so you have to be careful about extrapolating. But what I think we can take away from this is that masks, when worn both by a potentially infected student and everyone around them, really provide a great degree of protection for kids in school when it's done right and consistently.
Okay, thank you, Dr. Pavia. Next question, and Dr. Hurst, can you take this? Other than masks, can you list the other layers of prevention that were present in your study?
Great, yeah, great question. And this is a real world study. We were investigating the real world situation in the Granite School District. And the steps that each school takes on the ground, vary. There's recommendations around improving ventilation, which were able to be executed in many schools, keeping doors open, windows open when possible, changing filters, upgrading filters, increasing air exchange. All of that is important and part of our mitigation strategies. Other things that are enforced and encouraged for school attendance are staying home when sick. And teachers and staff members and parents and students themselves are on the lookout now for symptoms of a respiratory infection in a way that they never had before. So keeping people home from school when they otherwise might have attended is an important part of mitigation strategies. We're here talking about the fact that the schools in the Granite School District had spacing of 3 feet with all of these other things, but it's not to diminish the importance of keeping space, as much space as is possible. So when masks are on and really fitting well, 3 feet of distance between students seems to be safe. However, in circumstances where masks are off, such as lunch, it's really important to ensure that there's more spacing than 3 feet, ideally 6 feet or even greater.
Thank you, Dr. Hurst.
Yeah, it's worth emphasizing that greater spacing was used in lunchrooms and anytime children were eating. So when you couldn't have desks farther than 3 feet apart, that was strictly for the classroom setting.
Okay, thank you, Dr. Pavia. I also wanted to know that we have Ben Horsley available to answer questions, who is the spokesperson for Granite School District, where this research was conducted. And Ben, I'm going to give this question to you, and then others, there are 2 experts chime in as well. How were the schools selected, and can you speak to the ethics of research on children? I'm assuming by that you're talking about permissions from parents. But Ben, can you talk about maybe how Granite School District came to be involved with the Utah Hero Project?
To be honest, we started some testing protocols and worked well, came into contact with our nursing coordinator as we were doing contact tracing early in the November time period. Dr. Hurst could speak to a little bit about his relationship with Dr. Allison Tanner with our group here. And the Hero Project kind of took hold, and we liked some of the things that they were doing and wanted to, obviously coming back to school in the midst of a pandemic, there's a lot of concern with parents and particularly with staff. And so anything we could do to provide additional information and help to our community, we felt like that was the prudent thing to do. With respect to what the ethics of doing research, I want to say with kids, not on kids. That sounds like really weird when we say on children. Children were not harmed in any way, shape, or form as a result of this research. What we did do is provide COVID testing. And so access to our schools and to our students, of course, with parental permission. And you would find, I think, by and large, the good doctors can speak to this a little more clearly. Our parents were very excited about the opportunity to have access to increased and enhanced testing in these school locations. We started off in the early December time period with 2 initial schools and then quickly spread to 20 schools overall throughout Granite School District, so that we had, if you're not familiar with Granite School District, we're one of the most socio and ethnic diverse districts, not only in the state, but in the entire Intermountain West. We have some of the most impoverished students in the nation, and we have also some of the wealthiest. And then we speak over 100 different languages with our families within our schools. And so we wanted to provide the Hero Project access to a variety of different socio and ethnic groups to take advantage of the diversity that we have here in Granite School District, and lend that type of comprehensive approach to their study. And I think that worked quite well. So with respect to that, children did receive testing with parental permission. And then Dr. Hirsch could speak a little bit further. When they did identify cases, they would actually go out into the homes and offer additional testing. And then the genome testing was actually the coolest part of this, to kind of actually track the actual virus itself to see where the spread was occurring and if it's the same strain that was in the classroom. So that's very exciting. We're very pleased to be a part of that.
Thanks, Ben. Dr. Hirsch, do you have anything to add to that?
I just add that picking up on what we heard from Ben, that the genetic testing of viruses was limited but extremely insightful. In 3 circumstances where there was a case in the school who was contagious, and then one of the contacts in the school, such as a classmate, then 5 or 7 days later went on to test positive. In 3 of those circumstances, we were able to do genetic sequencing on the first case and the subsequent case. In all 3 of those instances, it was evident that the viruses were of a completely different lineage, which told us that the second case that we detected was not related to the first case and came from somewhere else outside of the school. On all 5 of the cases in our study that we are presuming were school associated, unfortunately, we were unable to do the genetic testing. So it's possible that one or even more of those 5 cases that we were considering likely school associated, because we did not have another explanation for it, such as people being sick in the household, other exposure points. It's possible that one or more of those would have shown a different lineage, which would have even shown that the mitigation strategies, prevention strategies that are being used in the Granite elementary schools and many other elementary schools around the country are even safer than what we're estimating.
Okay, great. Thank you, Dr. Hirsch. A question from Aaron. I think I'm going to send this to Dr. Pavia. Was there any difference in what you found by the age of the kids? Elementary kids can be about 5 to 12 years. So were the cases transmitted in school mostly older kids or younger kids, or were they mostly from teachers and staff?
So I should probably let Adam answer that, but of the 5 transmissions, I believe 1 was to staff and 4 to children. And with those small numbers, we really can't say much about age range. Adam, do you want to add anything?
Nope, there's nothing more to add. They were sort of distributed. The original cases were in students. There were 4 student-to-student presumed transmissions and 1 student-to-staff member. As I mentioned before, it's important to just reiterate that in 4 of the 5 presumed transmissions, it seemed pretty clear that the students involved were having some challenges around the time of contagiousness with mask use, or they were really, close buddies and sat closer than would be ideal together at lunch. And we know this is the real world. This is a challenge. But again, I think the small number of cases that were detected really speaks to the amazing work that our school teachers, our staff of schools, and the students themselves, the amazing work that they're doing to keep everyone safe.
And then a quick clarification, just once again, were the schools in the study, were they holding PE and music classes at the time or not?
I'm going to go ahead and take that just real quick, and the answer is yes. We offer a comprehensive music and PE program. These are all elementary schools, so they're also engaged in recess as well. And going back to Aaron's follow-up question with respect to lunch, I think lunch is actually one of the areas where we're able to mitigate more than we normally would within the classroom itself. We spaced a lot of our lunches out so that there was time for kids to come and sit spaced out and make sure, so when they were taking off their masks, they were more socially distanced than they would be even on the playground or in the classroom itself.
Okay, thanks. And Ben, I'm going to let you take this one and then have Dr. Pavia or Hirsch hop in as well. Does this mean the real world social distancing in Granite District Elementary classroom has never been 6 feet? And she said, I don't mean to be critical of that, but we do have large classes in Utah, as we all know. Utah has unique circumstances that likely aided the study. Is that correct? Is that a correct read of what we found?
That's absolutely correct. And Marjorie, we've worked together for how long, right? That's a unique thing to the state of Utah, and I actually believe that's a benefit to the study itself because you're dealing with the largest class sizes in the nation. And so our ability to socially distance from day one of this fall school year with in-person instruction has been very limited. And so certain classes were impacted in certain ways, depending on how many of their students were participating in distance learning. And so you might see a class with only 16 or 17 kids in it instead of 28 or 32. And guess what? Those numbers are actually pretty comparable to the rest of the nation, whose average class size is only 18. And so the fact that we have more kids in our classroom and we still saw very little transmission on school property goes to the testament that the fact that the protocols we were using and the mask wearing that being adhered to was quite effective. And so, yes, I don't think that's been something we're hiding from. Our goal from day one as part of our plans and our protocols was to distance as much as possible while on school property. And obviously, there were limitations to that from.
But I think, as you got a sense from Ben, is that being aware of the crowding issues and the difficulty in social distancing probably meant that our teachers in our schools really worked extra hard on assuring safety. So there may have been a paradoxical benefit to knowing that they faced a bigger challenge. They did an even better job.
Thanks, Dr. Pavia. Another question, was the CDC guidance just based on the Utah schools, or was there monitoring that was done elsewhere in the country? And were those results similar elsewhere to what we found here in Utah? Dr. Pavia or Dr. Hirsch, whichever one of you wants to take that one.
I can take that. It's a short answer. There's now, this work adds to a growing body of observational studies that have shown that the distance, whether it's 6 feet, 5 feet, 4 feet, or 3 feet, and there've been a few studies that have compared schools that were using 3 foot distance directly to schools that were using 6 foot distance, for instance, in Massachusetts. And all of these studies have arrived at the same conclusion, which is that there does not appear to be any difference in the transmission rate based on 3 feet or more up to, say, 6 feet, or in some cases even more, in the context of really aggressive adherence to all of the other mitigation and prevention strategies. If these students and teachers and staff members weren't wearing masks, it would have been a totally different story. I think we all know that, but it's important to remind ourselves that this is a contagious virus. It will transmit, but the mask and some degree of distancing and caution during periods where the masks are off is extremely effective in reducing spread.
Yeah. Nobody ever thought that 6 feet was a magic distance. It's just based on the fact that around a circle, virus is going to disperse more the bigger the distance. And all prevention is layered prevention. So you get distance helps. Mask on the person who's infected is the most important piece. Mask on the person who's exposed is important, and ventilation is important. And all these things were in place. So no one magic number mattered when all these layers are there to protect.
A question for you, Dr. Hirsch, from Marjorie Cortez. What you mentioned, an independent school that was involved. Is that a charter school? Is that a private school, a public charter?
Private school.
And okay. And a question for you, Dr. Pavia, sort of what you were just talking about. Now that we're looking at 3 feet of distance, feeling safe in schools, is that potentially going to inform our social distancing policies in other settings? For example, at work, in elevators, at the mall? Do you think this maybe opens the door to that, or is this simply just for elementary schools?
I think it's dangerous to extrapolate too far. Schools are a very controlled setting. Certainly outdoors, it would be a similar situation where less distance is important. But, exposure is distance times time, plus the layers on the infected person, the layer on the person who's being exposed. all those things matter. If within 3 feet of someone on an elevator for 30 seconds, it's very different than sitting within 3 feet of them for an hour and a half at a meal. And of course, at a meal, you wouldn't have a mask on. So I don't think it's a simple answer, even if it sounds like a simple question.
Right. Thank you. Another question, Dr. Hirsch, could the guidance change again? And are there more studies being done in schools and with kids as we move forward?
Yeah, there are certainly areas where guidance could continue to evolve based on the continued generation of evidence. So the kinds of things that are, they're continue to emphasize, but deserve further investigation are things like effectiveness of different types of ventilation strategies, for instance, effectiveness of different types of masks, for instance, the role of testing in school populations, if at all. If so, how often and who? All of those are examples, in my view, of the types of circumstances that could continue to evolve as time goes on. And then the other sort of unknown, as we all learned with this, is that as the pandemic evolves and as circumstances change, we need to be able to adapt to the new circumstances. And the adaptations that occur are going to be based on our experience, common sense, what we've learned so far. And boy, we've learned a whole lot more during this school year than what we knew in the summer, and newly generated evidence that is going to continue to emerge.
Great, thank you. Are there any other questions from media at this time, or anything else that any of the three of you would like to add about this exciting work? I think it feels like, right now we're starting to turn a lot of corners and looking into the future, a hopeful sense of a new normal. So I want to thank you all for participating today. Marjorie has a question. Is the HERO project, this is a good one and something I think we've talked about, is the HERO project planning to study transmission in Utah middle and high schools? Ben, do you have any answers about that? You're muted, Ben.
Of course I am. Not the way that goes. We are very open to additional research opportunities. We feel like not just Granite, but the state of Utah has been on the forefront, obviously, of in-person instruction. And the fact that our numbers to this point in time are less, we show a comparable across-the-board average of less than 2% confirmed on-school transmission. This is obviously just focused on the elementary side of that. We do have data that shores up the safety of the protocols that are in place at the secondary level. And I would point out that the protocol changes at the state level have already been implemented as a result of this HERO project testing that's kind of guided state department health officials and then also local school level data on our contact tracing efforts. And so we are so open to continuing to lead the nation in terms of understanding how COVID is transmitted. And we've had great partners here with the University of Utah. Again, our parents have been so willing to be involved and engaged with this testing to ensure that not only they stay safe, they want to know too, but that can inform national decision making, which you saw be announced today.
Great, thank you. And I do have one last question. I'm going to give this to you, Dr. Pavia. When do we think that kids will be able to get the COVID vaccine, and how might that change the picture in schools going forward, maybe next fall? I'd like to get your thoughts on that.
Well, I'm very excited about the ability of vaccination of kids to completely change the picture of what we're doing in schools. I think that's really our exciting ticket to a new normal. The studies for children 12 to 17 are largely enrolled and close to finished. The data should be out in the next several months, and most at it think that we're going to be able to vaccinate children over 12 by the beginning of the school year. Now, a lot can go wrong. That's, assumes that everything looks good with the data and it looks safe. You heard announcement that Moderna has sped up the investigation of vaccination in kids 6 months to 11 years of age. So now that timeline may be moving up, and we may be able to vaccinate younger kids sometime later this winter or by Christmas time. How could that change schools? Well, I think if teachers are vaccinated, parents are vaccinated, kids are vaccinated, we're going to see very little transmission in the community in all likelihood. And if that's the case, school can really return to a new normal. New normal will probably still be more strict exclusion of sick kids, better hand washing, improvements in ventilation. But that's what it's going to take to get rid of masks, to get back to all of our indoor sports, our dances, all the things that happen out back of the bleachers after the dance.
Right, thank you so much. We appreciate all of you participating today, and we're so excited about this new research and the part that Utah Hero and our experts in Granite School District were able to play in that. So thank you so much. We'll have a recording of this press conference available to you shortly, and we'll send that out. Thank you, everyone.